Hello, and welcome to another edition of Your Therapist Needs Therapy, the podcast where two mental health professionals talk about their mental health journey and how they navigate mental wellness while working in the mental health field. I'm your host, Jeremy Schumacher, licensed marriage and family therapist. To support the show, head over to patreon.com/wellness with Jer. I'm a mental health professional, not a professional podcaster. So any likes or shares or subscribes is all really helpful. Today, I'm joined with a local therapist who this is my first chance to connect with. So I'm super stoked to connect. Love talking to people in the local community and connecting people to different resources. I'm joined by Abby Carncross. Abby, thanks for joining me today.
Thanks for having me.
I start with the same question every episode, which is, how did you get into the mental health field?
Yeah, so it's been a bit of a roundabout journey to get to where I'm at right now. As a kid, really struggled with anxiety. I was always kind of told that I was a worrier, wasn't really given direction on putting the name anxiety to what I was feeling. And then kind of went into college. I was actually in nursing school for the first 2 years of college. Thought I wanted to do the medical field. Realized I don't like needles, so definitely not for me.
Sure.
Pivoted and went more towards the psychology route, and then ended up getting my master's degree in school counseling. So decided to go that route with the counseling platform, and then was a school counselor for a few years. COVID hit and really changed the way that schools were functioning, and kind of became more of like a substitute teacher than a counselor, which is not really what I went into the field for.
Yeah.
I had some pretty major health issues in 2021, right in the middle of COVID. I actually went into cardiac arrest randomly. Really was super healthy, didn't have many health issues before then. And, that experience being in a hospital during COVID, couldn't have any visitors or my family, kind of changed my perspective in just how we treat people in a professional setting from both a mental health and a medical side of things. So recovered from that and then decided to go back to get an additional degree in professional counseling. Worked at a behavioral health hospital for a couple years, met a lot of really amazing therapists that kind of helped guide me to where I am today, taught me a lot of what I know, and then ended up in this small private practice with my friend Taylor.
Yeah. And I want to talk about the private practice a little bit more, but there's so much in that story to unpack.
Absolutely.
So I think most of the guests I've had on the podcast have like this idea of they want to help people.
Right.
And I'm curious what your sort of upbringing was, because I did the same thing that you did as far as like I went the medical route. I was pre-med and psych double major until I got to OChem 2 and was like, oh, no, that medical school thing's not going to happen. So I'm curious, like, what was the messaging around that? Was it sort of like, oh, I'm going to be a doctor or nurse because that's how you help people? Did you have an awareness of some of the mental health options, or was that just like later in life?
Yeah, so my mom actually was a social studies teacher, and I always really was kind of thinking that's what I wanted to do because it was, helping kids and really being in environment where I was impactful to other people, which is, that helping profession still. And as I went through high school, the conversation around, compensation and public education came around, and decided that I could still help people and be a nurse, and really kind of started going that direction of learning medical terminology, got my CNA certification, and I was like, I can do this. I'm all right at this. So that's kind of how I started going towards the nursing school pathway.
Yeah, I love that. I took Latin in high school, which is a waste of time studying a dead language. But because I was like, oh, that'll help in med school in all the disease names and medications that have these Latin bases. So when did the school counseling thing sort of shift, or when were you aware hey, this might be the better fit? Obviously the fear of needles and some of those things, but how the pivot then to the psychology side of things?
Yeah, so throughout my education, even back to middle high school, I really struggled with like memorization. Math was definitely not my strong suit. Both my younger sisters are amazing at math, and they've chosen careers that are more suited for the way that their brain works, but definitely not my strong suit. So when I was in college, a lot of nursing is math, which is what I slowly learned,
Yeah.
and really struggled, wasn't happy. Kind of leaned on my teammates. I ran cross country in college, or cross country and track in college. So they were in more the medical mental health side of things and helped kind of guide me towards school counseling.
Yeah. Yeah. Awesome. Pre-COVID,
Yes.
we have to create this demarcation now, right?
Yeah.
My dad's a school counselor. Both my parents are teachers. My dad's a school counselor as well. It's one of those professions that like I think kids in school don't appreciate.
Yeah.
And then all the adults in the world are like, well, we just can throw a school counselor at every problem and that'll solve it. So there's a weird kind of juxtaposition between maybe how the kids and the people who you're in the building with every day responds to the profession of school counseling, and then how the wider world, the adults, view it. Is
Yeah.
that accurate to say?
I think so. I mean, when you think of a school counselor, I worked at a middle school with like 300 kids, and I was the only school counselor in the entire middle school. And this was kind of in the transition of post-COVID-ish beginning. And a lot of mental health issues came out of COVID, and people had to, forced isolation, which is kind of, that primary depression symptom that people face. And when they came back to school, it was a rough transition. A lot of kids needed support and guidance and how to process what just happened in this pandemic. So it just wasn't feasible for me to support all these kids and help them in the way I wanted to.
Yeah. I don't want to complain about society at large because I do that often. But like, it is one of those, like, mental health is this amorphous sort of blob, and like, let's just throw like the mental health professionals at it. But like, it's a system that doesn't necessarily support or staff things appropriately. Where you think of how many kids are needed. A lot of schools now have sort of that floating school psychologist who's working, they're in the building 1 day a week or 2 days a week at different schools. And like, that's not ever, I'm going to say pretty confidently, that's not ever going to meet the need for what kids actually have going through, not just a tough time of life as their brains start developing and school gets harder and a lot of different mental health issues can pop up in that time of life, but also just for life transitions. Their parents are getting divorced, their friend moves away, there's a global pandemic, another school shooting, like pick a thing.
Right.
And to say like, oh, we have a school psychologist who's on staff, one in the building 2 days a week, that's good. Like that math doesn't math.
Yeah. And it's really unfortunate. And I quickly learned that I was not really fulfilling my overall goal of a profession of helping others. And, that's kind of what steered me to going the professional route of realizing, I can help more people if I have this additional experience and ability to treat more people outside of what I could do as a school counselor.
Yeah. And COVID was, I mean, I was in higher ed at the time. I was doing mental health for student athletes, which like doubly brutal because most of them, their only coping mechanism was being in a sport, and sports got taken away. They lost their team. They couldn't go to the gym to work out. Like pretty much everything that kept athletes functional in that time was taken away from them, in addition to lots of panic about school and all that stuff. So a very stressful time. I'm curious if you don't mind sharing a little bit about kind of how you navigated that, riding the edge of burnout, being burned out. I'm guessing it was a common experience for anyone working in a school setting at that time. Like, how did you sort of navigate taking care of yourself before coming to the realization of like, hey, there's a different route I want to take here?
Yeah. So ironically, running has always been a huge outlet for me. I used it in college when I was competing, and then post-college, I decided to train for a couple marathons, which was, an entirely different beast in and of itself. But a lot of it was spending time with friends and family and making sure that I was doing valued activities outside of my job to kind of balance the kind of brick wall I felt like I was hitting when I was at my job. So that was kind of more so just being mindful of what I needed outside of the workplace.
Yeah. Yeah. Which is, super important. One of the things that made COVID so hard was not being able to necessarily gather with people in the way that was natural to us or that we're wired for.
Yeah.
And one of those, I would say, like lingering sort of cultural traumas that doesn't have a clean ending. It's our brains are storytelling, and they want to kind of put a bow. There wants to be a clear conclusion to a lot of things. And so one of those lingering, ongoing sort of things, I mentioned school shootings earlier, is like that also is like this lingering crisis because there is no resolution. I was in elementary school when Columbine happened, and we haven't changed anything since then. Like, so there's sort of this like still open wound for a lot of folks where maybe the burnout has subsided, maybe a lot of those stressors have subsided, but like it's a messy thing for our mental health to not be able to put a bow on it and say, this chapter's closed, this makes sense, we can kind of turn the page.
Yeah, and I think, that what really stands out to me when you were talking about that is like that fear of the unknown. And, we always want kids to feel safe going to school. I mean, I feel like should be a given when even as parents sending them to school. I can't imagine, being in a situation where that is something that I have to be more mindful of. And we could talk all day about the brokenness of the school system and what they could need more of. But I do think mental health is a pretty big gap in quality education for a lot of these kids.
Yeah. And I think people are aware of that, but just saying it as a talking point is different than funding it or supporting it appropriately.
Absolutely. Yeah.
Which is sort of where we're in this holding pattern as a profession. I would say on the professional side of things, like, the research is all there, but we're not in charge of our own funding, unfortunately. So then you have this health crisis that hits. And if something like running has been like that big coping mechanism for you and that physical outlet, like when your body does a thing that it's not supposed to do.
Right. Yeah.
That not only those physical impacts, but then that mental health impact of like not being able to trust or like know what's going on next. Again, that fear of the unknown.
Yeah, absolutely. And, so something I'm sorting through today is the cause of the cardiac arrest is really unknown. I never really got that closure as to, this is what caused it. And I think I see that too in a lot of the clients that I see is people want like an answer or a reason behind why they might be feeling the way they do. And I think I can resonate with that of, I had this basically near-death experience and don't have an answer for it. So I recently got back into running earlier this year, and it's a little bit scary going for a run and not knowing how my body's going to react, and kind of made it my mission to, obviously with monitoring with my doctors, I'm running a half marathon in a few weeks. And that's kind of been my comeback for proving to myself, like, I am okay. I am healthy. And even though it's scary, I can do this.
Yeah. And that's such a common experience, even for known things. I coach women's volleyball, so many torn ACLs. You're healed, you've done everything to recover, but like those first few times you're out on the court playing at game speed, like those nerves are there, that anxiety of like, could it happen again? Is my body going to respond the way I need it to? Injuries are obviously, like, we see the physical component, but that mental health component can be a real, I'm going to say it's a real mind fuck, like genuinely, because you don't know if it's going to do, and you kind of have to almost like desensitize your brain to that that worry of like, look, I can do it, one foot in front of
Mhm.
the other, I can jump, I can run, I can do these things, and it's going to respond the way I want. And then that added layer of not knowing what caused it creates, I
Mhm.
would imagine, some lingering anxiety.
Yes, absolutely. And I think even after the hospital stay that I had and being discharged, and is like, okay, like we don't know why, but you look good, like good luck. And
Yeah.
the helplessness that I experienced after that, I mean, I had a lot of like broken ribs and was in a lot of pain, and also really struggled with the depression of kind of losing this um, security I had, and knowing like I was a healthy individual, I was taking care of myself, and now I have to rely on others to take care of me. And
Yeah.
it was definitely a moment that I felt a lot of shame and a lot of like weakness,
Mhm.
and it's kind of humbled me today to like a lot of my clients' stories and where they come from, to understand that feeling as well.
Yeah. Yeah. And that like loss of identity
Yeah,
again tied
absolutely.
to mental health with athletes for so long, like even just graduating sometimes
Hmm.
your senior year of an athletic and you're like, now what do I do? I'm done with my sport? Question
Yeah.
mark. Like most
Hmm.
and 99% of people don't go pro in their sport.
Yeah.
So
Yep.
like it's just one of those things. And again, not only is it a coping skill and there's community around it, but like it is part of your identity to be
Hmm.
a healthy person, an able-bodied person, to be a
Yep.
competitor. Those are all important parts of people's identity, especially if they
Yeah.
grew up doing the same sport.
Yeah, absolutely. And I was really fortunate to have a amazing collegiate coach, and he was really great about making sure we were taking care of ourselves outside of our sport.
Mhm.
I went to a D3 school, so honestly, I was kind of running for fun and to
Yeah.
meet people, and I formed some really great friendships on that team, and still connect with outside of there too. You go through a lot in college, a lot of identifying who you are, what you want to do with your life. I mean, at
Mhm.
18 years old, you're being asked to decide like what career you want to do for the rest of your life, and that's pretty scary.
Yeah.
So I was really fortunate to have a really great support system with my coach and my teammates.
Yeah. Yeah. And so going through that process of post athletic career and like reevaluating, like as adults we don't stop doing sports, it just looks different, it's not
Yeah,
organized for us the same way. um but yeah, that injury, it's
yeah,
as a mental health provider who's worked with athletes, like I hear you, I saw so many people struggle with
yeah.
like, now what? Because I thought
Hmm.
I could do all these things, I thought I could just do the hard thing and it was just effort, it was just show up and do the thing and I'm cool, and now like it's not that, my body's not doing what I want.
Right.
um So then coming out of that, transitioning to let's go get another degree, different licensure.
Yeah,
Um, how is that journey for you? I'm always curious for people who go back to school what it's like,
yeah,
because I don't know. I think we stereotypically have this idea of like school is that 18 to 22-year-old range. And like that's when you do it. And then, right, you're supposed to do that thing for the rest of your life. Even when we have mountains of research that says 65% of people change their college major, Americans have between 3 to 7 different career paths in their lifetime.
yep.
So, like, we know this is a typical experience, and yet we don't hold a lot of space or talk about it very often.
Yeah, I think uh, when I was deciding on going back to, get that additional degree, it was only like, I think, a few more classes and then like a practicum.
Yeah.
I really felt like I wanted to change the career path. I never planned on going to school for 4 years and then an additional 4 years. And school was never my favorite thing.
Yeah.
Ironically, I was diagnosed with ADHD long after I was done with my master's program, which makes a lot of sense in hindsight now. But I really fell in love with it. I had a really great practicum. My supervisor was awesome, and her uh, co-therapist. I did it at Rogers, so
Yeah.
um, worked in the depression recovery adolescent program, and they really kind of helped me find my confidence in myself as a clinician, and taught me a lot of the foundation of just being a therapist in this kind of setting.
Yeah. Yeah. I love that. I think not to, again, complain about systems, but like it is a bad system to throw 18 to 22-year-olds into this sort of world to expect that they know what they want to do and can do it. We don't have a good internship program. We don't have journeyman. Like, again, there are some exceptions, plumber, electrician, there are some hands-on learning spaces, but a lot of it is we don't have any experience in our chosen career path in high school by the time we're supposed to be picking our career path.
Yep.
And so knowing what some of that looks like, you can correct me if I overstate something here. Again, my dad's a school counselor, but he's been doing it for forever, so I don't want to oversimplify. But the big difference between like a school counselor and someone who's like an LPC or an MFT is being able to diagnose, and that like kind of higher level of care, where a lot of times for school counseling, because their structure and the system isn't there to do full-on treatment, you're going to refer something like a full-blown diagnosis out to a provider, whereas now you're on the other side of it, of getting those referrals to see that person who has anxiety, has depression, has the higher level mental health that requires that next level of treatment.
Yeah, I think my approach as a clinician, I always say, like, we have to diagnose for insurance purposes. And at times, like with 504s, IEPs, stuff like that with the school system. I feel like my stance is to always treat the symptoms and not necessarily the diagnosis. A lot of times, with mental health stigma in general, when you give someone a diagnosis, there's a certain amount of weight that sometimes comes with that. And I really try to reiterate to my clients that, you could be experiencing depression and it could look totally different than someone else I see. So that's why I think that, I have to diagnose. And I also think that it's important to view the whole person and not just one diagnosis.
Yeah. And it's I've been doing mental health for 15 years. It's a weird experience because I've sort of swung all the way back around on diagnosis. On specific diagnosis, I would say, like you mentioned, late stage diagnosis, ADHD. I was diagnosed my last semester of postgrad. It's not a super useful time to get your diagnosis. But I work with a lot of people who are neurodivergent and are getting a diagnosis in their late 20s and their 30s and their 40s, even in some cases. And I do think that a diagnosis like that is super helpful. Like understanding why your brain is doing the thing that it's doing is really helpful. Whereas I don't do personality disorders. I think they're shitty diagnoses. I think it's describing symptoms, not explaining where it's coming from. And so that those diagnoses that help people understand what's going on so they can make different choices or have more autonomy is really helpful for people. They don't feel crazy anymore. Like, it's not lack of willpower, talking about ADHD. It's not because I'm lazy. It's because of this. So I think some diagnoses, when they're done well and they fit for the client, like really work well. And I think there's still some of the distastefulness of like slapping a label on this group of symptoms and like and now you're just bipolar for the rest of your life, or now you're just depressed for the rest of your life. Like I don't like that type of diagnosis. I think too many clinicians are still doing it that way, as if that like explains everything, whereas that's not helpful if it's not catered to what the client's actually experiencing.
Yeah, and I think it comes down to like the function of giving a diagnosis. I mean, I totally agree. It can be really affirming, especially to someone who wants like an explanation to how they're feeling, what they're feeling. And it also needs to be a delicate balance of like it not becoming their identity. I mean, I have a lot of clients come in and say, I am bipolar. And it's like, whoa, hang on a second. Like you are not, like you don't hold bipolar and that's like your identity. It's like, I have bipolar and this is how it presents for me. And this is what I can do to navigate it. So I think I agree. It gives a good umbrella of guidance of, these different tools can help with this specific diagnosis. And we need to make sure it's not going to be your whole identity.
Right. Yeah. And again, like I think when it is helpful for the client, it makes a lot of sense. Yes, we're trained how to do it because we have to go through insurance. I don't take insurance at this point, so I don't have to diagnose. But like, ADHD tends to be one because of my own lived experience and my expertise around it. But I don't like to call it expertise. My lived experience and a lot of experience with clients working with it. But it's also one of those things where like it is really helpful to get the diagnosis. Where depression, there's all these different symptoms that might show up. Even with
Mhm.
ADHD, I guess there's 20 different diagnostic criteria. You need 6 of them for a diagnosis. Like that
Yeah.
can look really different for different people, which is why so many of us fell through the cracks
Yeah,
early in our
exactly.
life and didn't get diagnosed because we didn't fit what kind of the diagnostic criteria at the
Mhm.
time were designed to catch.
Yeah. And I think, when I was getting evaluated for ADHD, a lot of the symptoms I experience are more of like the women with ADHD, which is like, I feel like constantly coming up with new things. And
Mhm.
once I talked to my mom about it after I had the evaluation, she's like, oh my gosh, this makes so much sense. Because
Yeah.
when I was in elementary school, it was like ADHD is this hyperactive, can't pay attention, like problem behavior kind of kid, and that never really fit me. I was the anxious warrior, followed all the rules kind of kid,
Yeah.
which at the time that didn't match ADHD.
Hmm. Yeah. ADHD, especially through the 90s and early 2000s, was pretty much just catching hyperactive boys,
Yeah, exactly.
which is not the way the diagnosis actually works. It's not how neurodivergence actually works. It's pretty
Hmm.
split pretty
Hmm.
evenly between different genders. So it's not
Yeah.
like a thing. But again, that's where like the medical model and the deficit approach really only catches certain people who are like not fitting into society's standards well enough, as
Right.
opposed to saying, how is this thing affecting you personally?
Hmm. Yeah, and I think that, comes down to, for me, staying organized and like remembering a lot of different things is
Hmm.
hard. And what was cool about leaving a big organization where, you were taught to do your job a certain way and coming now to the outpatient world, like I get to make it my own, and I get to
Yeah.
organize and take notes in a way that makes sense for my brain and then not
Hmm.
necessarily someone else. So that's been kind of fun to navigate. What works for me and not necessarily being told a specific protocol that I have to follow.
Yeah. Yeah. And obviously, this is a topic I cover a lot on like how to run a private practice, but like you show up more authentically when you're doing it the way that makes sense to you and your clients pick up on that. That's meaningful. I have some weird, quirky redundancies, especially around billing, and I need
Mhm.
to do things multiple times so I don't forget.
Yes.
And like that might not make sense to somebody else's brains. Even I've talked to other providers who are ADHD themselves, and they're like, "Why do you do it that way? Like that's just extra work." And I'm like, "I don't know, but like it's a catch. Like it works well for me. It helps me stay on top of it. So like I do it that way." And again, when you're not having to meet someone else's standards, when you're not trying to follow an Aurora or a Freighter protocol or a Rogers protocol, you can do it in a way that helps you, and then you have more mental energy, you have more space to show up authentically for your clients.
Yeah, and I think, what's cool is being in the outpatient setting with being able to pull from all these different modalities that I've learned and learning new things too,
Yeah.
and, I really take a person-centered approach with my clients of like, "Okay, DBT is not really working for you. Maybe we need to go back and like give some just basic education on um like how your brain works and like the CBT triangle and all those kinds of
Yeah.
things." So it's been fun to make it my own and do what works for me.
Yeah. Yeah, and there isn't one model that fits
Right.
everyone, and
Mhm.
so, like, even that idea when I was going through grad school, the idea of being, like, an eclectic or an integrative was the term back then. An
Yeah.
integrative therapist, where you're drawing from other models, was, like, frowned upon. Like, you need
Yeah.
to be a purist, you need to pick
Mhm.
your thing and get
Mhm.
really good at it.
Yeah.
And, like, that just especially as a neurodivergent person, like, that never made sense to me.
Uh-huh.
Like,
Mhm.
tell me I fit in this box and I'm gonna like try and prove all the ways in which I don't, because that's some of my persistent drive for autonomy showing up. Like, yeah, no, like I'm gonna do the exact opposite if you force me to do it that way. Um, so I think it just again opens up a lot of space for us as providers to show up in a human, in an authentic, in a genuine way, and it's less of that like hierarchical
Yeah.
expert and patient.
Mhm.
Even like I use client usually as my term to refer to the people I'm working with. And like I don't love that. Like A, it's capitalistic, which I'm not on board with, but B, like it still is a little bit of a power dynamic, but like definitely don't want to talk about patient. Like I don't use the medical model. And so even little language like that, I think lets
Mhm.
clients know. And again, there's a time and a place for the medical model. I'm not throwing it totally under the bus, but
Yeah.
trying to to say like, this is how I'd work, and if you want to work with
Mhm.
me, this is what you're going to get. And that works really well for some people, and some people are like, nah, I want worksheets, I want homework, I want the very structured thing. And I'm like, hey, awesome, here are some
Mhm.
people who are really good at that.
Yeah, and funny that you mentioned that. Just random thought. I'd use the word patient charting at Rogers, and then client when like, in outpatient. So
Yeah.
switching my brain like from something I've done for a long time to now is also kind of trips me up at times.
Yeah, it is weird, different jargony language. And even just, I mean, like how you write notes, people do
Yeah,
DAP, people do DART, people do SOAP. Like there's all these different
yeah.
silly acronyms and like have to do it this way. And again, I'm a big advocate for getting into private practice, getting off insurance panels. I've been in the field for a long time, so I'm at a place where I'm comfortable to do that. I know that's not accessible to everyone. It's a privileged place that I'm in, but like I do think at this stage in my career, that's what lets me show up the way I want. It's ethically aligned with how I want to practice, and that gets clients who want to work with me to me faster and gives me more space to work with them. So I'm a big fan of that.
Yeah, I think um, my experience at Rogers is, I was working in the PHP, like IOP level of care. And
Hmm.
some people don't know this, but a lot of times we get patients with Medicaid and they can't get residential benefits. Medicaid doesn't cover residential. And
Yeah.
it was really disheartening to, be a therapist and giving it your all at the highest level of care that this person can receive, and it just not being enough.
Yeah.
I tried talking to as high up as people as I could. I wrote a letter to the lieutenant governor about how we weren't providing quality care to these people who really needed it.
Mhm.
So when I came into the outpatient setting, I talked to my colleague Taylor about how I want to make sure I give as accessible amount of care as I can. And sometimes she has to rein me in a little bit because I'm like, I'll give therapy for free.
Yeah.
But this is a career. I have to make money and pay my bills. But I do feel like that was something, and still something, that I'm really passionate about, is providing access to people who can't receive it, or there's some kind of barrier with that.
Yeah, for sure. It's this back and forth of how do we see as many people as we can? And we didn't pick capitalism either. We
Yep,
were also born into it. So like we have to pay our bills.
I know.
Um, and it's an uncomfortable space. As a marriage therapist, like I'm a systems thinker. And so it's just one of those things too, where like the burnout rate for people working in those high intensity places isn't because our clients are so high intense, but because the structure, the
Yep.
support systems around it aren't there. So we have these like dead ends that we're walking and people's journeys with them to. And like it's very unhelpful, unsatisfying. Like it's a very frustrating process to run into. Insurance is only going to cover this number of sessions, or insurance isn't going to
Mhm.
cover that diagnosis. Or again, as a marriage therapist, I ran into that all the time on insurance panels, was like, you only get 8 sessions. Like, well, for couples counseling, we might just be getting started 8 sessions in. Sometimes we're done, but sometimes it's a longer process. So just all these like bureaucratic sort of red tape
Yeah.
sort of things that people run into. And here's my diatribe about capitalism, but like it is a punishment in America to be poor, like to not
Yeah.
have resources. There's all these extra hoops to jump through. Instead of the people who are well resourced, they get to cut through all that red tape or skip it. And for the people who are not well resourced, they have to do even more work. And like that's a policy choice, not a necessary thing.
Yeah, and I think it's frustrating being in this helping profession. And obviously, everyone kind of became a therapist for a reason. Like you want to help people.
Yeah.
And when the system's blocking you from that goal of being able to get people the care that they need, it's really frustrating. It's really disheartening. And sometimes people don't prioritize your opinion. My direct supervisors at Rogers always really agreed with me and said, it's a system issue. It's not necessarily like a Rogers thing. I mean, they
Yeah.
do what they can to provide grants and things, but they also are a business and need to make money. So it's definitely a broken system, and it's definitely like something I always will say needs to change and be better, especially
Yeah.
post COVID. We just talked about how big the mental health crisis is. So, I get fired up talking about
Yeah.
needing to provide more access to people.
Yes. Yeah. And like the insurance companies ultimately is where all this money is going, you know.
Yeah.
I'll wrap up our diatribe here, but like,
Right.
there's 7 major insurance providers in America who all made over $1 billion of profit last year. Like, that's where the money is. That's where it's going. It's not going to clients. It's not going to providers. It is going to these other entities serving as a middleman purely to make profit.
Yeah.
Which is why it won't work doing it the way we're doing it. We need to change it, but like there are some slowly small, like SciPact is a really great outcome since COVID, where different providers can see people across state lines, and like that opened up during COVID because it just needed to, but then they tightened it back up unnecessarily.
Right.
And all the different providers have kind of come together and said, that's dumb. Don't do that. Like, we need to be able to see people. One of my specialties is religious trauma, and there aren't a lot of providers who do that. So being able to see people in different states, like, makes a huge difference for people who are in rural communities or can't see someone because of, everybody knows everybody, or they're in a cult maybe, or whatever, where like seeing someone in their local community is going to put them at risk. And so there are some changes. I don't like to be doom and gloom about it. I like to be realistic about, shit's broken and we know how it's broken. Like, we need to change it. But it needs to change faster than it is. There are some changes. Abby, tell me a little bit about Every Little Fiber. How did that come about? I contacted you just reading on the website and like loving the approach, really vibing with it. So tell me about how that all sort of came together, where you're at now.
Yeah, so I met Taylor at Rogers. She was a eating disorder dietitian in one of the programs I initially was working with, and we, on times we had breaks, would talk about this dream of having like a clinic to provide care to people. She eventually wants a teaching kitchen to teach people how to make meals and how to grocery shop. And, we had this big dream of what we wanted. And it got to the point where we felt like, we wanted to do something that was our own and not necessarily falling in like a certain protocol. So she actually took the jump before I did. I still had my in-training license at the time, so couldn't practice independently. She started the outpatient thing last October, so coming up on a year now. And I just joined her in July, so pretty new for me. But it's been a lot of fun. We have really made it our own. We're offering joyful movement groups. We just had an open house where we focused on the 6 pillars of wellness, and it's been cool to work collaboratively with her, especially with eating disorder clients or those that are needing both nutrition and mental health counseling. So just kind of trying to prioritize the overall wellness, and that it's not kind of just one thing. It can be many things to focus on.
Yeah. And I love, obviously, like, holistic can be a buzzword that people throw around. I think collaborative is too. Like, those are words that every therapist has in their profile. But like really practicing what you preach on, like having someone who has this other specialty, who can look at the diet and nutrition, who can look at how each human body, the brain, gut health, we have a lot of research on that stuff. Each person's diet might need to be, or nutritional intake might need to be tweaked a little bit. And like, research shows having a healthy diet, having regular exercise, and sleeping well are like, that makes like a 40% improvement in people's mental health. And none of that is specifically mental health related. All of that's kind of physical stuff that we're doing.
Yeah, I think that one of the things that I do with a lot of clients is just the like sorting values and identifying like what's important to you and what are some behavioral changes we can make to meet those goals, or maybe areas that we've been lacking in. And I don't know about you, but I feel like becoming an adult after college is like, how do I feed myself? Like, okay, I actually have to make like meals and grocery shop and all of those kinds of things. So sometimes that kind of falls to the wayside. And I know Taylor really enjoys the young adults navigating that journey. But making sure that we're meeting all areas of wellness and not just the mental health piece, as you said, to make sure that we're living the healthiest life possible.
Yeah. And I say this all the time in therapy, like your brain is part of your body. It isn't,
Yep.
mental health
Mhm.
isn't separate from physical health. They're the same thing.
Mhm.
Um, and yeah, like there's just a lot of misinformation, I think, around healthy eating. And there's a
Mhm.
lot of misinformation around how, again, that brain gut connection.
Yeah.
I think, I don't know. I don't even think that's fully accepted yet, let alone like everyone knows about it, let alone
Yeah.
everyone knows what to do on an individual level.
Mhm.
Um, but like this idea that like as we get older, our metabolism slows down, like that's
Mhm.
recently been proven to be false. It's almost exclusively because we become less active as we get older. It's lifestyle stuff, not a biological thing. And so, yeah, like how do you grocery shop? Where do you get your food? How do you fuel yourself appropriately? One of the things I talk about with clients, it's usually couched in stress relief, but like it's about physical movement. Like,
Yeah.
can you go for a walk over your lunch break? Like
Mhm.
finding 10 minutes here, 15 minutes there. Not everyone has an extra hour to go to the gym. So like how do we move regularly? How do we get up and go to the water cooler, a couple times over the hour so we're not just sitting for so long?
Mhm. Yeah, and I think that, when people think of exercise, I think automatically jumping to like, okay, I need to like lift and go to the gym or
Hmm.
run, go for a bike ride. But I think that physical activity and just overall exercise can be even more than that. It can just be taking your dog for a walk or
Yeah.
walking through the park. It doesn't have to be, again, that like one size fits all kind of narrative of what exercise is.
Yeah.
I think that's important to know too.
Yeah. And that like when I talk about exercise, I talk about elevated heart rate for 20-25 minutes.
Yeah.
That's what we need for heart health long term. That's what we need for cardiovascular health long term. Like you don't have to do weightlifting if you don't like it. You don't have to do P90X or CrossFit or any of these like intense, crazy training regimens. You just gotta move for 20 to 25 minutes.
Yeah. I think that one thing that we see a lot is like doing things to an extreme, whether it's like a specific diet and you're restricting
Mhm.
calories that you need to consume, or you have to only eat a specific kind of food, or you have to go to the gym for 3 hours a day. Uh, and unfortunately, it's like, okay, like you're doing like one thing to an extreme, but if you did like a balance of everything, that probably would achieve more of the goal that you're wanting. Just everything in moderation is good.
Yeah. Yeah. I have Taylor lined up to be a guest on the podcast in a couple weeks. So I'm excited to dig in with her a little
Oh,
bit
yeah.
more on kind of her treatment approach and what she brings to the table from a different background than just straight mental health.
Yeah.
Um, which, yeah, is exciting. I learned at late stage diagnosis for ADHD. I didn't really like integrate my diagnosis till I was 30, which is when I had to make some life changes. I had a kid, but also just like back pain, knee pain, like some different
Mhm.
stuff where like I'd been an athlete for so long and
Mhm.
just like high metabolism. Like I don't even think it was anything else. Like I think it was just that. And so again, like that lifestyle change didn't really hit until I was about 30, where it's like, oh dang, like I don't know how to eat healthy. I've
Yeah.
never had to worry about it before.
Mhm.
And so it's just again, like wherever you're at is okay. Like
Right.
to learn this stuff now is good. Even if you feel like you're behind or you should know it, like
Yeah.
we don't have a great system for how to take care of our bodies all the time. Like,
Mhm.
sorry, education system, but like the physical education we get is pretty lacking. I can speak to Wisconsin at least, is pretty lacking, and like tying mental health to nutritional intake, to sleep hygiene, like stress relief, mindfulness. Like most
Mhm.
people are not doing any of this stuff. They don't even learn it
Mhm.
until they go to therapy, which is
Yeah.
not to put therapy on a pedestal. It's just to say, if you're like, oh yeah, I don't know how to do that, that's okay. Like now's the time to learn.
Yeah. I always tell my clients that they're an expert on them, and I've got
Mhm.
all this knowledge and these ideas, and I can point out patterns that I see, but it's ultimately them that uh, wants needs to want to like make the changes and kind of view things from an open mind. I think it's easy to kind of fall into patterns of, okay, I'm working all day and I didn't take a break for lunch,
Yeah.
or like I skipped breakfast because I woke up late.
Yeah.
And eventually that kind of falls into a habit. And I think that that's kind of what's cool about even coming to therapy is seeing a third party perspective of like this wide scope of your life and things you can change to improve it.
Yeah. Yeah, and so much of that stuff gets normalized. Like, oh, working hard, so I got up early and I skipped breakfast. Or college students notoriously do not get enough
Mm-hmm.
sleep because like that's baked in as like you don't,
Mm-hmm.
like you cram or whatever. And it's like,
Mm-hmm.
oh, like we need to stop normalizing some of that stuff that very obviously has impacts long term.
Yeah, no, I totally agree. I think that I feel like I have this sleep conversation with almost every client that I see of like, hey, like we need to not watch TV for hours in bed, or like maybe we need to put our phone away from our beds. We're not like checking it at 2 a.m.
Yeah.
And just like the little tweaks can make a big difference from at least what I've seen.
Yeah, for sure. I talk about sleep hygiene with most of my clients and talk about stress relief because most people are not getting enough of either.
Yes.
Segue here, Abby. What does stress relief look like for you now? I don't want to say you've made it to like the promised land. That overhypes it. But you're in private practice. You're practicing in a way that's ethically aligned. Still, this job is stressful in a kind of unique way. How do you take care of yourself? What does stress relief or finding space for joy look like in your life right
now? One of the things I quickly learned was that I need to take a break during the middle of the day. It's easy to kind of get really into doing like making a group or doing my notes or starting a new job, and you're really excited. And a lot of times when I don't take that break, I don't eat enough for lunch, or don't have time to like reset my brain before seeing more people. So I've actually like from like an hour during the day, I'll eat lunch and I'll just like watch a cartoon on Netflix. Usually it's Scooby-Doo. So going back to my childhood.
Very cool.
But then, when I go home, very silly, I sign my dogs up for swimming lessons. So I take them to swimming lessons twice a week, and they are slowly learning to like water. But just doing those little things of, okay, this could be fun, I want to try it out, and making sure I'm having a good work-life balance, which can be easy to slip to the side sometimes.
Yeah. And I mentioned this earlier, but like stop working through your lunch breaks, people. Like go for a walk, go outside, like give your brain something different to do, give your body something different to do. It makes such a big difference. Again, we normalize so much of this stuff, or going home and doing progress notes at the end of the day because like you don't want to fall behind on them, and like there's all this pressure to I mean, dog swim lessons sound like a very fun activity.
Oh, it is a blast.
But also like something that's structured is a big thing I talk about with clients a lot too. Like something that's in your calendar consistently makes it easier for you to do it, rather than like coming up off the top of your head with something to do that's good for your mental health or your physical well-being. Like, no, I have it scheduled for you, so you just have to show up. That makes it more likely that you're going to do that.
Yeah, I think that it helps to have a accountability partner too. My colleague Taylor, I know you're talking to her in a couple of weeks, was never a runner before. So when I decided to sign up for a half marathon, somehow convinced her to do it with me. She never really ran more than a 5K in her life. But it's been kind of fun to hold each other accountable of like, I'm, wake up in the morning and I'm like, tell her like, I don't want to run today. And she's like, well, like we signed up for this and like, it's in 3 weeks. We can't back out because we did the non-refundable plan. And so having that person that's holding you accountable too, I think is always helpful.
Yeah. And you use your dogs for swim lessons. I talk about structuring things around like walking your dog. I'm a big dog lover. So like, first of all, get a dog. They're great. But also like their brains are a little simpler than ours. So like they're not stressed about the Supreme Court or the stock market or anything that we as humans worry about. They're like, it's 5 o'clock. It's time to go for an exercise. I don't even want to say the word because my Great Dane mix is sleeping on the couch behind me. She'll pop up if I say it. But it's one of those things where like, finding that system or that structure that makes sense for you. Accountability partners are great. Sometimes there are kids. Sometimes there are pets. Sometimes it's a bowling league that we're a part of and we don't want to not show up because the other team will be disappointed. Like that little bit of extra pressure helps us stick to our consistent schedule.
Yeah, absolutely. I think it's been fun to have at least one thing or two things during the week that are scheduled, and it forced me to take a break and think about something outside of, my career or other stressors I might have going on in my life. I mean, I think my dog's biggest stressor is a garbage bag rolling down the street, and she's barking at it for like 10 minutes and then it rolls back. So sometimes I get home from work and I'm like, hey, like, what did you do today, Nala? And she's like, oh, I pretend she's talking. You'll say like, oh, I slept all day. So
yeah. What kind of dog do you have?
She's a mini golden doodle.
Okay.
Yeah.
I have Great Dane mix. We used to have two. One passed away a couple years ago, but we've got the Great Dane mix and a long-haired Chihuahua. So we've got the big little mix in our house. I love Great Danes. Going back to your Scooby-Doo reference, I think because I loved Scooby-Doo as a kid. Like,
yeah,
it's always kind of been there, the big dogs for me.
Yeah, I think it's fun to take a break during the day and watch Scooby-Doo, and I'm like, oh, I remember what the mystery was in this one. So it's a little bit easier thinking-wise than sessions.
I have to ask you, this is a new question I've added to the podcast for all my neurodivergent folks. Do you have any bird tattoos?
No, I've stick to mostly ocean waves.
Okay. We're slowly building a data set on bird tattoo and neurodivergence overlap. It's a high correlation we're learning.
Yeah,
so now I gotta ask everyone.
I haven't heard that. No, I've got 3 tattoos and 2 of them involve waves in them. So
yeah, I think a lot of us ADHDers like nature, like it's stimulating in a healthy way for our brains. So that makes sense too.
Yeah.
Abby, if people want to learn more about the work you're doing, if they want to work with you, if they want to connect with you, where do they go? How do they find you?
Yeah, they can go to my website, everylittlefiber.com. We also have an Instagram where we occasionally post pictures of our dogs. So that's always a nice little added bonus. I also do free consultation calls. I want to make sure that people are being fit with a therapist that's great for them. It doesn't always have to be me. Everyone's on their own journey and deserves to have the best quality care possible. So I'm always happy to consult and guide people in the direction that they want to go.
Yeah, for sure. And we will have links to all of that stuff in the show notes so people can find it. Abby,
Awesome.
Thanks so much for taking the time to join me today.
Yeah, thanks so much for having me.
And to all the wonderful listeners out there, thanks for tuning in again this week. We'll be back next week with another new episode. Take care, everyone.